If you're over 60, what I'm about to share is going to stun you. After speaking with hundreds of healthcare professionals, I've discovered the unsettling truth about what doctors are actually thinking when they treat older adults. These 5 harsh realities are costing you quality care, respect, and possibly years of your life. Think about that for a moment. One retired doctor described it as the healthcare industry's worst-kept secret. Don't let another doctor's appointment go by without understanding what's truly happening behind the scenes. This knowledge could save your life. Welcome to Life Advice for Older People. What you are about to hear will fundamentally alter how you approach healthcare for the rest of your life. Today I'm pulling back the curtain on 5 brutal truths about medical ageism that the healthcare establishment wants to keep hidden from seniors. Here's our roadmap. First, the startling mental shortcuts doctors take the instant they see your age on a chart. Second, the unsettling financial calculations that occur during your treatment decisions. Third, why your symptoms are being viewed through a lens of dangerous stereotypes. Fourth, the prescribing habits that specifically target older patients. And fifth, the most heart-wrenching assumption about your cognitive skills that is impacting the quality of your diagnosis. But here's the most empowering part. I'll share the exact strategies that successful seniors use to turn these dynamics around and command top-tier healthcare. If you've ever felt dismissed, hurried, or condescended to by medical professionals, this video is going to arm you with the tools to make sure that never happens again. Hit that like button right now if you are ready for the truth, and be sure to subscribe with notifications on, because this information could literally be life-saving. Comment below with your biggest healthcare frustration. Let's dive in. They mentally tag you as expensive and complicated before you even say a word. The second you walk into a medical office, your age starts an immediate mental calculation in your doctor's head. Healthcare professionals are trained to evaluate resource intensity, and seniors are automatically placed into the high-maintenance category. This isn't necessarily malicious. It's a form of systematic programming that influences every interaction you will have. Dr. Sarah Henderson, a former emergency room physician who now advocates for senior rights, shared this disturbing reality. Medical schools teach efficiency protocols that basically pre-categorize patients into age groups. Seniors are assumed to need longer appointments, additional tests, and complex medication plans. This builds an unconscious bias before the exam even starts. The financial pressure, well, that really magnifies this bias. With insurance reimbursements dropping and patient quotas rising, doctors today are under a lot of economic stress when treating older adults. Your comprehensive health requirements often conflict with their tight schedule, and frankly, that can create a subtle resentment that might affect the quality of care you get. Studies reveal that doctors spend roughly 23% less time actively listening to patients over 65 compared to younger patients who have the exact same symptoms. Let's consider what happened to 74-year-old retired librarian Maxine. She showed up to her appointment, equipped with a detailed list of symptoms she had been monitoring for weeks. But before she could even get through her first sentence, the doctor interrupted, saying, "Let's just focus on your main issue today." When Maxine attempted to explain that her symptoms were interconnected, the physician just sighed and replied, "We have to prioritize." Her chest pain was written off as anxiety, which ultimately delayed a cardiac diagnosis by 6 months. This so-called complexity aversion isn't just about managing time. Doctors frequently avoid ordering comprehensive tests for seniors, assuming the results might uncover multiple issues needing extensive treatment plans. What most people don't realize is they'd rather treat surface-level symptoms than dig deeper and risk unearthing systemic problems. The psychological effect of this is, well, pretty significant. When healthcare providers approach you with these preconceived notions about difficulty and expense, they are less inclined to partner with you on a collaborative treatment plan. Instead, they often default to standard protocols designed for so-called typical senior problems, rather than truly investigating your specific situation. Right. So here's how you can fight back immediately. Begin every appointment by stating your specific measurable health objectives. Instead of simply saying, "I feel tired," try saying something like, "My energy has dropped by 40 over 3 months, and my goal is to pinpoint the cause." You see, this transforms you from a quote-unquote complicated senior into a goal-oriented patient in their eyes. Bring a concise one-page health summary that highlights any improvements you've made from previous treatments. That way, you're demonstrating you're an active participant in your healthcare, not just a passive consumer of services. Doctors, honestly, respond much more positively to patients they view as partners instead of problems. And don't forget to ask for specific timeframes to address your concerns. For instance, you could say, "Doctor, I know we have limited time today. Can we please schedule a 30-minute follow-up next week to thoroughly review my cardiovascular concerns?" This demonstrates respect for their schedule, while also advocating for the proper care. Also, be sure to document everything during your appointments. When doctors notice you taking notes, they understand you are paying close attention and will likely recall details. This kind of accountability, well, it truly does shift their behavior and communication style quite a bit. They use what you might call polite medical gaslighting to dismiss your symptoms as just a normal part of aging. Medical gaslighting aimed at seniors has sadly become so common that healthcare professionals often don't even realize they're doing it. When doctors chalk up legitimate symptoms to normal aging, they're engaging in a socially acceptable form of discrimination that unfortunately delays a proper diagnosis and treatment. Music doctor Michael Torres, a geriatrician who has dedicated his career to fighting ageism in medicine, puts it this way: the phrase, "you're just getting older," has turned into a medical excuse. It's used to brush off symptoms that would prompt immediate investigation in younger individuals. This is not evidence-based medicine, it's age-based guesswork. Music, his statistics are frankly quite startling. Research from the American Geriatric Society reveals that 85% of serious conditions in seniors are first attributed to aging before they get a correct diagnosis. Heart disease presents as, fatigue from getting older. Thyroid issues become a normal decline in energy. Depression is labeled an adjustment to aging, and cancer signs are written off as simple wear and tear. Take 67-year-old former construction supervisor Carl. For 8 months, he complained about growing joint stiffness and fatigue to his family physician. Each time, the response was the same: "Carl, you're not 30 anymore. Your body's slowing down." When Carl finally insisted on blood work, they found severe rheumatoid arthritis that had been creating permanent joint damage during those months of dismissal. Can you picture that happening? The gaslighting tends to follow some predictable patterns. Doctors will use phrases like, "at your age," "that's to be expected," or "we all slow down a bit," to steer conversations away from actually looking into symptoms. They'll suggest generic fixes: more exercise, better sleep, stress management, without figuring out why these issues appeared so suddenly. Women can face double discrimination, with their symptoms dismissed as both aging and hormonal shifts. Men's concerns about sexual health or emotional shifts are often brushed aside as normal male aging. Mental health issues get especially dangerous handling, with depression and anxiety attributed to life stage changes instead of being investigated as actual medical conditions. The most insidious part is how this gaslighting can make seniors start to doubt their own perceptions. When authority figures repeatedly insist that your concerning symptoms are normal, you start to question your own judgment. This self-doubt can delay seeking medical help, and honestly just leads to worse outcomes. Here's your defense plan. Always reply to age-based dismissals with targeted questions. When a doctor says, "that's normal for your age," you can ask, "what percentage of people my age have this exact symptom? What research supports that this level of symptom is considered typical?" Most doctors can't back it up with evidence because they are operating on assumptions, not medical facts. Create symptom timelines that show sudden changes instead of a gradual decline. Rather than saying, "I'm more tired lately," present data. "My energy levels were consistent until March 15th, when I suddenly started needing afternoon naps for the first time ever." This shifts your concern from an aging complaint to an acute onset symptom. Request specific diagnostic criteria. Ask, "what tests would you run if I were 40 and had these exact same symptoms?" This compels them to justify different standards of care based only on age. Frequently, they'll recognize their own age bias and order the right investigations. Use the concern escalation technique. State clearly, "Doctor, I realize aging can affect energy, but this is a major change from my baseline. I'm worried this might point to an underlying issue. What diagnostic steps can we take to rule out medical causes before we just attribute this to aging?" Bring an advocate with you to appointments. When another person is there to witness dismissive behavior, doctors often adjust their responses. Your advocate can ask follow-up questions you might forget and help you document the discussion. Are you seeing a pattern here? If you've experienced this kind of dismissive treatment, let me know in the comments below, and smash that like button if this is resonating with you. They secretly believe you're mentally declining and won't be able to follow complex treatment plans. One of the most harmful assumptions in senior healthcare is the automatic presumption of cognitive decline. Doctors frequently simplify treatment explanations, steer clear of complex therapeutic options, and base medical decisions on age-related intelligence stereotypes instead of individual assessment. Music doctor Amanda Richardson, a neuropsychologist who researches medical bias, explains the shocking reality. Healthcare providers consistently undervalue the cognitive abilities of patients over 65. They'll suggest simpler, less effective treatments because they assume seniors cannot handle sophisticated medical regimens. This starts a devastating cycle where older adults receive suboptimal care because of baseless assumptions about their mental capacity. The effect of this goes far beyond just hurt feelings. When doctors presume you can't grasp complex treatments, they won't offer you cutting-edge therapies, detailed treatment choices, or comprehensive diagnostic tests. Instead, they fall back on basic interventions that demand minimal patient involvement or understanding. Think about 71-year-old retired chemistry professor Louise. When she was diagnosed with early-stage breast cancer, her oncologist right away recommended a simple mastectomy and didn't discuss reconstruction options, targeted therapies, or clinical trials. He justified the decision by saying, "At your age, we want to keep things as straightforward as possible." Louise had to battle for months to get access to the same treatment protocols offered to younger women who had an identical diagnosis. This cognitive prejudice shows up in subtle ways. Doctors might speak more slowly, use simpler vocabulary, and give oversimplified explanations to seniors, no matter their education level or proven intelligence. They'll leave out technical details that would help you make an informed choice, assuming you wouldn't get it anyway. The medication management assumption is especially risky. Healthcare providers often pick less effective drugs with simpler dosing schedules, thinking that seniors can't manage complex medication routines. They'll prescribe once-daily medications that are less therapeutic than multi-dose alternatives, prioritizing what they see as compliance over optimal health outcomes. Technology discrimination makes the problem worse. Doctors assume older adults can't use health monitoring apps, electronic medical portals, or other digital communication tools. This assumption cuts you off from modern healthcare resources that could enhance your treatment results and your communication with providers. The self-fulfilling prophecy becomes tragic when seniors start to internalize these expectations. After repeated experiences with simplified explanations and dumbed-down treatment choices, some older adults begin to believe they really can't handle complex medical information, which creates an actual dependency that didn't exist before, right? So here's how to shatter these assumptions right away. Start every medical discussion by mentioning your educational background, your professional experience, or any other relevant expertise you have. You could say something like, "I managed complex projects for 30 years, so please provide me with the detailed medical information I need to make an informed choice." Don't be afraid to ask for technical explanations using proper medical terms. For instance, you could request, "Doctor, can you please explain the pathophysiology of my condition and how each treatment option works on the underlying mechanisms?" This really demonstrates your desire and, well, your capacity for sophisticated medical details. Bring evidence of your cognitive skills, like articles you've researched on your condition, questions you have prepared based on medical journals, or notes from other specialists. This kind of tangible proof of your engagement pretty much forces them to let go of their assumptions. If you are offered simplified recommendations, challenge them directly. Ask, "What other therapies would you recommend if I were 45 with this same diagnosis? I want to understand every available option, no matter how complex." Use technology proactively during your appointments. Access your health apps, pull up your digital medical records, or use your phone to look up medication interactions right there in the office. When doctors see that you're comfortable with technology, well, it really challenges their assumptions about what seniors are capable of. And finally, request detailed written treatment plans and medication information. Just tell them, "I would like comprehensive documentation of my treatment options so I can review and research each one thoroughly." This makes it clear you plan to be an active, informed partner in your own healthcare decisions. Now, here's something really troubling. Medications are often prescribed as a form of behavioral control rather than genuine medical treatment. The most disturbing truth about senior healthcare is the way drugs are used to manage behavior, not to treat underlying medical problems. Healthcare providers all too often prescribe psychiatric drugs, sedatives, and mood stabilizers to older adults, not because of a diagnosed mental health condition, but simply because these medications make patients easier to handle in medical settings and care facilities. Music Dr. James Martinez, a former nursing home medical director who now works as a patient advocate, has brought this practice to light. He says, "I've seen countless instances where medications were given not to improve a patient's health, but to lighten the staff's workload. Anxious seniors were given sedatives, assertive patients got mood stabilizers, and those who asked too many questions were put on antidepressants. It's chemical restraint posing as medical care." Music, the statistics are honestly just horrifying. Over 40 of seniors are prescribed at least one psychiatric drug, but only 12 have a diagnosed mental health condition that actually needs pharmaceutical help. The rest of those prescriptions, well, they appear to be for administrative convenience rather than any true medical necessity. And these drugs, they frequently cause some pretty dangerous side effects, like falls, cognitive decline, and even a higher risk of mortality. Consider for a moment what happened to 69-year-old former school principal Beverly. After her hip surgery, she grew frustrated with the slow progress of her rehab and began asking, detailed questions about her recovery schedule. The healthcare team ended up labeling her as difficult and prescribed her an anxiety medication to help her relax. But the medication led to confusion and balance issues, which caused a fall that broke her wrist. So while her original injury healed, the complications from the medication actually prolonged her recovery by 4 months. Music, the use of drugs for behavioral control, it really extends beyond just psychiatric medications. Doctors often prescribe sleep aids for seniors who are just having normal age-related shifts in sleep patterns, not an actual sleep disorder. Pain medications are frequently withheld from seniors with legitimate pain because, providers sometimes think they're drug-seeking, or perhaps exaggerating their pain for attention. Blood pressure medications too are often given at doses that cause dizziness and fatigue, making older adults less likely to be active or assertive during their appointments. And when patients do complain about these side effects, doctors have a tendency to dismiss them as necessary trade-offs instead of, adjusting the prescription or even exploring other options. Music, now perhaps the most insidious part of this is how these medications can end up creating the very problems they're supposed to treat. For instance, sedatives might cause confusion, which then gets diagnosed as dementia. Mood stabilizers, they can cause apathy, which is often labeled as depression. And sleep aids, those can disrupt your natural sleep cycles, leading to real sleep disorders that ironically require even more medication. Healthcare facilities, they sometimes actively promote this practice because well-medicated patients just need less staff time and supervision. Insurance companies on their end support it too, since psychiatric drugs are less expensive than proper medical workups or, let's say, therapeutic interventions. And at times even families request it because they just can't cope with their loved one's very real emotional reactions to health crises. Your defense, honestly, begins with knowing exactly what each medication is for. Before you accept any prescription, you should always be asking, what specific medical condition is this medication intended to treat? What objective markers will be used to see if it's effective? And how will we know when it's time to stop? Try to avoid medications prescribed for vague issues like anxiety or agitations if there is no clear diagnostic criteria. It's smart to research every medication on your own using trustworthy medical databases. Look for side effect profiles, interaction dangers, and alternative treatments. You might discover that many behaviors that lead to psychiatric prescriptions can actually be handled through environmental adjustments, therapy, or by treating other underlying medical issues. Always insist on specific treatment goals and timelines. Say, I want measurable objectives for this medication. If I'm not seeing clear improvements within a set period, I want to discontinue it and look at other options. This helps to prevent the open-ended use of psychiatric drugs. Also request medication reviews with independent pharmacists or geriatric specialists, as these professionals can identify unnecessary drugs, dangerous interactions, and chances for deprescribing. Many seniors find out, sometimes to their shock, that they're taking medications with no real therapeutic benefit. Make sure to document your cognitive and physical abilities before you start any new psychiatric medication. Take cognitive assessments, balance tests, and mood evaluations. This baseline will help you identify medication-induced changes and provide you with evidence if you need to advocate for stopping it. And of course, build a support network that can speak up for you if medications ever impact your judgment or assertiveness. Pick someone who will question medical decisions and ensure your voice is heard, even if psychiatric drugs alter your personality or cognitive skills. The most heartbreaking reality in senior healthcare is how medical professionals assess your life's value when they make treatment recommendations. Behind the scenes, doctors use economic formulas that compare treatment costs against remaining quality life years, which often leads to seniors getting inferior care, not due to medical reasons, but because of age-based value judgments. Music doctor Patricia Chen, an ethics professor who has researched healthcare rationing, reveals this shocking truth. Medical education includes concepts like quality-adjusted life years that basically assign a numerical value to different lives. A 70-year-old's remaining years are calculated to be less valuable than a 40, which influences everything from organ transplant lists to cancer treatment plans. It's systematic age discrimination masked as medical economics. Music. This valuation system impacts treatment choices in devastating ways. Seniors are frequently denied expensive procedures, cutting-edge therapies, and aggressive treatments, not because they wouldn't benefit from them, but because the healthcare system has determined their remaining years aren't worth the financial investment. The same surgery that's readily offered to younger patients is suddenly too risky or not cost-effective for seniors with the exact same health profile. Consider, if you will, the experience of 68-year-old retired engineer Walter. When he was diagnosed with kidney failure, he was immediately steered toward palliative care and told that dialysis, well, might not be suitable at his age. Walter had to fight for 3 months just to get the same life-saving treatment that is regularly offered to younger patients. After he finally began dialysis, he got back to his full activity levels and went on to live 7 more productive years that he would have lost if he had just accepted the initial age-based treatment plan. Music. The discrimination unfortunately carries over to diagnostic procedures too. Expensive imaging scans, specialized tests, and preventive screenings are often refused to seniors based on actuarial tables, rather than on genuine medical need. Insurance companies and healthcare systems often use age as a main factor in their approval decisions, just assuming that seniors won't live long enough to gain from early detection or preventive care. Now, mental health treatment gets especially harsh age-based rationing. Depression and anxiety in older adults are frequently written off as natural responses to getting older instead of being treated with the same therapeutic approaches offered to younger people. Psychological therapy, psychiatric care, and mental health drugs are quite shockingly seen as wasteful for individuals who are assumed to have limited time left. The tragedy, honestly, gets worse when seniors start to internalize these value judgments. After repeated experiences with diminished care options, many older adults begin to feel their lives are somehow less worthy of being saved. They stop pushing for aggressive treatments, accept substandard care, and make end-of-life choices based more on society's devaluation of them than on their own desire to keep living. Emergency room care shows the most glaring discrimination. Seniors who show up with identical symptoms get fewer diagnostic tests, shorter exam times, and quicker discharge orders compared to younger patients. Emergency physicians will admit in private that age does influence their clinical decision-making, with older patients getting less thorough workups. The economic calculations become especially cruel when it comes to family discussions. Healthcare providers subtly guide families to pick less costly care options for their senior relatives, framing these limitations as comfort measures or age-appropriate care. Families are encouraged to think about the burden of aggressive treatment without fully understanding the complete range of available options. Your life has equal value regardless of your age, and you have to advocate for it. Always ask, would you recommend this same treatment if I were 45? If not, could you please explain the medical, not financial, reasons for the different recommendations? This forces providers to justify any age-based treatment discrimination. Research treatment outcomes for your specific condition in patients who are your age.
Many seniors have excellent responses to treatment that go against age-based assumptions. Bring this evidence with you to your medical appointments and demand access to all suitable therapies, regardless of their cost. Take out multiple medical opinions, especially from geriatric specialists who truly understand senior treatment outcomes. Many conditions that might prompt comfort care suggestions from general doctors have effective treatments when handled by age-focused specialists. Use legal advocacy if you need to. Age discrimination in healthcare is a violation of federal laws, and legal advocates who specialize in senior rights can assist you in accessing denied treatments. Document every instance where age seems to be influencing treatment decisions. Connect with senior advocacy groups that can offer support and resources for fighting healthcare discrimination. These organizations understand the system's biases and can help guide you through appeal processes and alternative treatment paths. Remember that you have the right to refuse age-appropriate limits on your care. If you want aggressive treatment, comprehensive diagnostic testing, or cutting-edge therapies, you can insist on equal access, regardless of your age. Your life's value is not decided by an actuary's calculations. Now you understand the 5 ugly truths about medical age. This healthcare providers never wanted you to know. But here's what changes everything. Knowledge is power. And you now have the tools to change every medical encounter, from being a passive patient to an empowered advocate. Remember Walter, who fought for dialysis and lived 7 more productive years that doctors wanted to take from him, or Beverly, who overcame medication-induced setbacks to reclaim her recovery. These are not exceptional stories. They are what happens when seniors refuse to take discriminatory treatment based on their age alone. Every time you question age-based assumptions, demand equal care, or advocate for comprehensive treatment, you're not just fighting for yourself. You're helping to change how the entire healthcare system treats all seniors. Your assertiveness sends ripples that benefit every older adult who comes after you. The medical establishment hopes that seniors will stay passive, accepting subpar care without complaint. But you're different now. You see the biases, you understand the discrimination, and you have the strategies to overcome them. Your health, your dignity, and your remaining years are far too precious to give up to age. Transform your healthcare experience, starting today. You deserve medical care based on your individual health needs, not on stereotypes about your age group. If this exposed the healthcare discrimination you've experienced, smash that like button and share this video with every senior who deserves better treatment. Your story could save another senior's life. Comment below. Have you experienced medical age? What will you do differently at your next appointment? Let's support each other in demanding equal healthcare. Subscribe and hit that notification bell right now, because every senior deserves dignity, respect, and life-saving medical care, regardless of age. Together, we are changing healthcare forever. Like, subscribe, and let's keep fighting for the respect we all deserve.